My name's Clarke and I run Transition into Parenthood classes. The classes are for pregnant couples and I've been running the classes for 30 years here in the Sutherland Shire, in the beautiful suburb of Sylvania, which is really lovely and quiet and really leafy here. And I actually run them from my own home. And that's the classroom that we're in right now. So this was originally my husband's bar billiard room, which was hilarious. And when the bathroom got put in, I hijacked it and I said, no, this is my classroom. And it's the most perfect environment for pregnant couples. It's slightly underground, it's incredibly quiet, really comfortable. And I've had over 10,000 couples over 30 years come along through my classes. So,
individual couples?
Yeah,
Oh.
Isn't that amazing? Yeah, 10,000 couples over 30 years. So I love teaching the classes, I love helping people. Pregnant couples have a mixture of feelings of, excitement, they can't wait to have their baby, and also scared because of all the horror stories that are out there about birth and everything. And so what I do is cut to the chase and I help everybody in a really positive way, helping them to understand what are all the positive things they can do to actually prepare themselves, how to go through the labour and the birth as a team together, and then afterwards looking after their baby, and without having a lot of fuss and a lot of nonsense, but just making sure that they're meeting the baby's needs and reading the baby's signals. And most people don't know very much about babies, about newborns. So the other class I teach is called the New Mindful Hypnobirth course. And it's been around for about, hypnobirth has been around for about 20 years. And it's extremely focused on breathing, relaxation and visualization, so the use of the imagination. And the idea is that the woman is able to prepare herself emotionally, and in a nutshell, when she's using her breathing and she's totally relaxed and completely uninhibited, then it's as if she's just kind of gotten out of the way of her body, and her body can just get on and do exactly what it needs to do to birth her baby. Isn't that amazing? So often our head, with all the busy monkey mind, just gets in the way of so many things that we're trying to do physically, that especially birth. So if a woman's worried about things and she's distracted by things, and if she's really frightened and she's tight and tense and, really, oh my goodness, here comes another contraction. Well, then of course it's going to hurt like hell, to be frank and honest. And if I can train her and her partner to understand that as soon as they get a contraction, as soon as the uterus goes hard and tight, close the eyes, go within, cut off from everything around her, focus completely on her breathing and let go and relax, and actually let the contraction happen. It's actually easier than you realise, and the contraction only lasts for about a minute, and then we get a break and nothing's happening. And then when the next one comes, if we've trained ourselves, practiced it, then we're fine. So there's obviously a whole lot more going on in the background, and I explain all of that in the class, but what I decided to do just then was nutshell it for you. There was a doctor called Dr. Grantley Dick Reed, a bit of an awkward name really, but he was a doctor who was at war, tending the troops in the Second World War on the front line until he got shot. And when he got shot, he ended up with a whole heap of shrapnel down his back, and all his doctor colleagues did what they could to pull it all out, but they said, sorry buddy, but there's too much, too close to the spine, and what we have to do is actually ship you out of here. If we keep digging here, we're going to do more harm than good. So sorry, but you're heading home. So he went back to London. But of course, in the war effort meant that you couldn't just rehab. You couldn't put your feet up and rest. Anybody who was alive and functional actually had to keep working and contribute to the war effort somehow. So they stuck him in a hospital, and he had to receive anybody in, like any patient, and just look after them. And he had a whole heap of obviously labouring women. And so because he had such a massive level of self-awareness, he understood that to cope with his war injury, which of course gave him chronic pain, when he was optimistic and warm and comfortable and focused on his breathing and relaxed, he was fine to go to work. And then he started seeing these women coming in where some of them were screaming the joint down and ended up with incredibly dysfunctional labours needing heaps of medical intervention, and other women who came in, laboured, birthed, they were fine. And he's like, well, why would you end up with such a difference? Why would that happen? And when he thought about it, he wrote up all his observations and reflected on it, and then he said, I think I've got the key answer here. If I can teach women to use their breathing and to relax, to understand what's actually going on inside their body and let it happen, then they're going to be fine. And he was right. So he was the father of all childbirth classes. Nobody had ever taught any classes prior to him. So he wrote the most amazing book, and it's called Childbirth Without Fear. I've actually got an antique copy of it, and on the front is a quote by the Queen, Queen Elizabeth II, which is our current Queen, and it says, "Into a world where fear and pain are rampant, this book brings a message of hope." Signed, the Queen. And back in those days, that was the highest possible endorsement that a book could get. Isn't that incredible? So he then was doing his work, and then other people came along and went, "Oh, I love the work you're doing. I'm going to borrow bits of it too." And then we ended up with Lamar's. You probably have heard of Lamar's method. It's in all the movies. And the Bradley method. And anyway, hypnobirthing grew from that. And that's how it all began. I was really, really fortunate that I learned it when I had my kids. So when I had my first baby, everybody said, make sure you learn the breathing. And I was like, okay, the breathing. I didn't know why. I thought it was a distraction, but it actually helps you relax so that your body can get on with it. Otherwise, what you've got is adrenaline, and adrenaline hormone is the antidote to oxytocin. And oxytocin is the hormone we need to drive the labour. And so oxytocin is known as the love hormone. I don't know if you've ever heard of that before. And the love hormone will be very high in a woman's body if she feels safe, if she feels cared for, if she feels protected. But if she gets scared, or if she's upset about something or frightened, then adrenaline takes over. She has a long labour, a hard labour, a failure to progress labour, ending up with a caesarean section. So the more that she can relax and let the oxytocin take over, the quicker the labour, most efficient and more comfortable labour, much less stressful. It's amazing, isn't it? I make it sound really simple, but the other thing that she needs is really good support. Good support from the midwives, good support from her partner, and that's why it's so important for partners to come along to the classes too. Actually, they have a great time, they love it. And because these are very different to hospital classes, in hospital classes it's extremely superficial and they have massive size groups. The educators do the best they possibly can, but they're very limited on time. They haven't got very many resources available, and they get given a curriculum, and so they have to stick with the script. They can't respond to people's questions, and they can't be passionate and heartfelt about what they're getting across to people. So it's totally different. Hospital classes are limited in every way. Often the educators are gagged with what they're allowed to say, whereas I can be open and honest with people, and I can tell people what the truth is and what our current system is like, and I can also explain how to negotiate that and how to actually achieve the sort of birth that you would like to achieve, and how to avoid the things that you don't want to have. So my organisation, Transition into Parenthood, is the official business name, and that's sort of an umbrella. The classes that I teach there are either 2-day courses or 1-day course, so I can do a super condensed. And the other class, the Mindful Hypnobirth course for pregnant couples, that's done on 2 days or 1 day as well. So I kind of squash everything in the super condensed. And then the other thing that I've just started over the last few years is very special, and it's not so much for pregnant couples, it's for women. Anybody over the age of 18, I guess you'd say between 18 and 100, are welcome to come along and do the doula course. And so the doula course involves, I've got a couple of workbooks, and in fact I've got a kit here that I'm about to post off. There's a home study version of this. So it's where I train women in how to be a birth partner, and this is one of the very best textbooks that I send out. And then I've got some other textbooks, and then I've actually made my own book, which is a workbook for the women to work through. So I have no exams, they've got no heavy going assignments. All they need to do is read this, work through, answer all of the questions, send it back to me, and then I check everything and help them out with clarification, and then I give them a certificate, and they're a qualified doula. So they're able to go to births and attend births in any setting, whether it's home, birth centre, hospital, whether they are going into the operating theatre, They're well qualified to go and help women through their pregnancy. They understand massage and the whole way through their labour and birth. So normally a doula will come into the hospital and be by a woman's side for a few hours while she labours, and helps her with the breathing, the shower, the bath, acupressure points, massage, helps the partner to understand what they can do to help out too, and just remind him of things. And then the baby is born, and she may take some photos, and then the placenta comes out, and then the first breastfeed. So the course that I'm teaching covers all of that, how to help a woman through all of that. And then the other book I've written for doulas is the Postnatal Doula course. Post meaning after, natal the birth, doula. And this is where the woman in the training learns how to mother the mother. So during the first year after the baby is born, she's well qualified to go and help and give advice, guidance for both the mum and the dad, and just help wherever they need help, where it's general household or development of the baby, or there's loads of different ways. This is actually one of the best ways of reducing the risk of postnatal depression. Postnatal depression is one of the most awful things in Western society these days, where mums have had their baby and instead of being thrilled and happy and excited and loving the experience, they sink and they fall into a depression, which is signalled by feelings of hopelessness and helplessness. Some of it is to do with their expectations, but a lot of it is to do with a lack of help. And so when I train doulas, I'm helping to reduce postnatal depression. So having a doula come along and help in a million different ways on how to settle babies, calm babies, and helping with food and household tasks, it's enormously beneficial and helps to dramatically reduce the risk of postnatal depression. So I'm based here in the Sylvania area, which is a very pretty area of the Sutherland Shire, and I run the classes from my own home, and the parking is easy, it's free outside, and couples turn up and I say to them, guess what, I'm really stingy with break time. I'm only going to give you 10 minutes for morning tea and 30 minutes for lunch, and so bring heaps of food because I let you eat all day in the classroom. And they love that, especially pregnant women, right? They get starving. And so they love the freedom here. It's a very relaxed educational environment and we have a lot of fun. So it's adult education, and often the dads think of really funny one-liners and they crack jokes, and it is hilarious. So we actually go through a huge amount of information. The dads get such a massive amount out of it, and their confidence is enormous at the end of the day. So they've been exposed to a lot of information to do with the pregnancy, so where they're at right now in their pregnancy, what's coming up next, how he can fit into the picture of things, things to say and things not to say. Yeah, and then I've also got the book for him to flick through too. So the book of Transition into Parenthood, this is the first workbook one. And in here are lots of lists and ideas and checklists. Dads love that. Dads love everything in point form. It's almost like a car manual in what to do, how to do it. If you have this problem, here's how you solve it. And lots of pictures and diagrams and things as well, so that everybody's able to sort of understand things really quickly. And then the other one is all about baby care and parenting. So this is incredibly important. A lot of people don't realise, although we need to get ready for labour and birth, we've also got to get ready for baby care, looking after our baby. Sometimes people say, well, I think I'll just wing it. And that's okay, you could. But like so many other things in life that is so important, much better off being prepared and having an understanding of babies. So every weekend I teach the classes, and every weekend I have people saying, I've never actually held a baby, Julie, or I have, but only for 5 minutes, and it was somebody else's baby, so I have no clue what I'm doing with a baby. And so what I'm able to do is absolutely lift their knowledge, which boosts their confidence massively. So they get to take home these books. They're a fabulous representation of what we've covered in the class, plus a whole lot extra, and they're able to refer to this right through the first 5 years of parenting. So that is way beyond what the hospital classes do. They deal with the first week, how to change our nappy, how to start breastfeeding and how to do bathing and things like that. Real basic stuff. I agree. A lot of people say, oh, don't bother to prepare for the birth. Like, why would you be bothered? Like, it's only one day. It's not important. It's afterwards that matters. And I say, well, hold on a sec. The way that the birth unfolds is actually going to colour and flavour the way that a woman feels about herself in motherhood. So the birth does matter very much, and the maximum amount of support and love and kindness and care she can have is actually going to make a difference to how her birth unfolds and how she feels about it. Because we always reflect back on how did that go for me and who helped me and how, and so women will reflect back on their birth experience and how they feel about it, and that will actually have quite a significant. So for example, women who have a caesarean section, whether they planned it or they didn't plan it, they're 10 times more likely to have postnatal depression, and that's extraordinary. That's right across the whole Western world. So one of the other books, the other course that I have, the hypnobirthing course, I give everybody a choice of books. So this is a fabulous book from the UK. It's extremely positive, terrific, condensed book on hypnobirthing, mindful hypnobirthing, and this other one is quite an extensive one, and I just say, well, you can choose whichever one you'd like. And both of them are still covering the same information to do with the breathing and the relaxation, deep relaxation, and also with the mindfulness and the self-awareness comes the use of the imagination. And like anything else in life, if we imagine what we do want, we've got a much better chance of getting to that. So I'm able to guide them through what all their choices are, and then they start to realise, wow, I've got more options than I thought I had. And that's because most people have only seen birth through TV, through Hollywood movies. And of course in Hollywood movies what always happens is the waters break first, people panic, they have an ad break, and then there's more panic, and then there's a lot of yelling and screaming and drama, and then another ad break, and after the end of 30 minutes the baby pops out. One way or another the baby's born. And so that's what most people expect. It's going to be quick, it's going to be dramatic, it's going to be frightening, and my waters are going to break first. And the truth is, less than 10% of labours actually start that way. Isn't that incredible? And so most people are like, so when do the waters break? And I'm able to straighten all of that information out as well. What to expect to happen first, and what the domino effect is, or what the usual progression is. People love that. They're like, wow, I had no idea. I was completely wrong on all my thinking. And once I've straightened it all out for them, well, in fact, every day, and today I've got one too, is a text message going, Julie, we've had our baby. And a beautiful little tiny photo of their baby in the text message, and how wonderfully everything has gone. And much quicker than they expected it to be, and much easier than they expected it to be too. So I love getting those messages. It really makes everything worthwhile for me.
That's kind of the motive.
In our society, we have women who do have depression, and one of the ways that we can avoid that is to support them properly, really well during their pregnancy. So our whole society should be supporting them. And it is something that I promote in my classes, and we talk about a little bit, where there's too many horror stories being given to pregnant women, usually by other women or workmates. And they start off with, oh, you're pregnant, oh, well, I'll have to tell you this dreadful story. And so it's quite sad for pregnant women that they're copying all this negativity, and that's what they report to me in the class. This is so refreshing here because it is so positive and it's so proactive, and what you're teaching us we can actually use. And most of those negative stories are very disempowering for women to hear, and it's not the right way. It's not the right way, and we really have to change that. And there is a movement called the Positive Birth Movement, and I'm a part of that and have been, my whole career. And I'm always trying to help people understand it doesn't have to be scary. It doesn't have to be negative. It doesn't have to be that way. And once you've taken on board these principles and these ideas, and you do a little tiny bit of rehearsing or practice, it's easier than you realise. Well, because I've been pregnant, I've had to deal with it.
Yeah, of course.
Yeah. So personally, with both of my pregnancies, I did cop a lot of horror birth stories. And it was usually where people were saying, oh, you know, they made me lay on my back and they put my legs up in stirrups and they gave, you know, they did a forceps delivery to me. And there's this other thing that you might not have ever heard of before, and it's a bit unpleasant. It's called an episiotomy, and it's where they use scissors to cut the vagina. And of course, when you get way too many details about that stuff when you're pregnant, that's actually horrific. It's awful. And it traumatises women who are very sensitive in their pregnancy, and they're meant to be sensitive. That's the hormones, Mother Nature getting them ready for having a baby. And they're meant to be sensitive. But the unfortunate thing is that anything negative that's told to them, and certainly it happened to me, it really affects you. It really upsets you. It's awful. And so luckily, I realised I needed to deflect. And I needed to go, actually, you know what, that's got nothing to do with me, that other person's horror story. I'm really sorry that she had that experience, but it's not mine. I'm not going to the same place she went to, I haven't got the same doctor. I'm doing things differently. I don't think she prepared at all. I doubt that she knew anything about breathing, relaxation or active birth. And so when I gave birth, I had read quite a bit and I had asked a lot of questions and I had prepared. So I knew the breathing, the relaxation. I used the shower, the bath, hot packs. And when I gave birth in the squatting position. I didn't want to be on my back, and I said so. No, I don't want to lay on my back. And so in the squatting position, it actually opens up your pelvis by an extra 30%. Yeah, amazing. So you get into a squat and it opens up the pelvis and it shortens up the birth canal and helps you to get your baby out without needing any forceps. And you can stay in that position to deliver the placenta as well. And then the mum, if she's drug-free, is in great condition after the birth, and she's loaded with natural opiates that her body has made for her, and that's called endorphins. So after the baby is born, she's on an incredible high, and that's certainly what I experienced. So I was very fortunate. I knew I didn't want the gas, the morphine and the epidural. What I did want was a lot of help, and hot packs on my belly and my back, and the shower, and using the breathing and everything else. And so what I did after the baby was born, the midwife said, reach down and touch your baby. And so I thought, yes, what a good thing. And he was on a sterile drape between my feet. And I reached down and I touched him, and it was so soft and hot. I was really surprised that he was so hot. And then she said, lift your baby up. And I was like, oh yes, I want to do that. But I don't know how. Hands? No. Head and feet? No. And then I thought, I'll put my hands under his armpits. I actually didn't know that it was a boy yet. And so I placed my hands underneath his armpits and I lifted him up and I turned him around and I grabbed a hold of him and I had a lovely cuddle, and it was the best moment ever. And it was exactly what I'd been looking forward to the whole way through my pregnancy. I just can't wait to hold my baby. I just can't wait to get my arms around my baby and cuddle my baby. That's all I wanted to do, and look at him. And then the midwife said, hold your baby and look at your baby and things like that. And I did, and it was lovely. It was the loveliest moment. I was on the highest high I'd ever been on in my whole life. It was incredible. I was ecstatic. I was euphoric. And that's what Mother Nature does on purpose, so that we bond to our baby. And you turn into like a mother lioness, and you are so protective of your baby. And even though you have difficult times and the baby wants to feed a lot, and yes, they cry a lot, you still have this underlining feeling of, wow, my baby. And so, yeah, you get through the tough times that way. If I was watching a movie, I would love to see that. And do you know what? There's heaps of it on YouTube. If you just type in hypnobirth, natural birth, or, there's loads of women out there giving birth beautifully. And they're having amazing drug-free births and having water birth. All of our public hospitals allow water birth. The Department of Health of New South Wales completely endorses the safety of water birth. So most people, when they first hear of water birth, they're like, huh? You mean the baby's born in the bath, underwater, but wouldn't the baby drown? And the baby's already been in a 9-month bath. And so they know not to breathe that in. And when they come out into warm water in a bath, it's seen as a gentler birth. It's kinder to the baby, and it's kinder and easier to the mum as well. So it's beautiful. It's amazing. The other thing I can tell you is a lot of people in Western society think, oh, I'm so scared of birth that maybe I'll avoid it. And maybe what I'll do is choose to have a cesarean instead. And many people, I guess they have a simplistic view of cesareans. They think it's just a quick unzip, pop the baby out, zip it up again. And we were able to schedule it, and it was really easy. And yeah, and so heaps of people have cesareans. Our rate in Australia is 30%. And the World Health Organization say that is miles above what it's supposed to be. It's supposed to be about 10%. And so we've got heaps and heaps of women having a cesarean. So there's a thing though that matters about that, and that is that when the baby comes down the vaginal canal, it comes in contact with good bacteria that it's meant to come in contact with. So that's all over the baby's hands, it's all over the baby's face, and it's healthy bacteria. So the baby, when it goes to feed in the first hour, it'll suck its fist, and then it will ingest that good bacteria into its gut, and that's the first bacteria it receives. Next, the baby will lick on mum's breasts and take in the skin flora, the next bacteria, and then the baby will open its mouth wide, latch onto the breast and take in colostrum, the first milk. And all three are meant to mix together to set up the perfect gut flora for the baby right from the start, within that first hour. Isn't that incredible? But if we have a caesarean section, what they've discovered is that we have so many more allergies now, and these extreme peanut allergies and other allergies. And they know for sure, the academics know for sure, that much of that is caused by our high caesarean section rate. Yeah. So when couples have come through my classes, they've gotten to know me really well, and I've gotten to know them really well as well. And we're on the same page, basically. And then after they've had their baby, if they have any problems, any issues, any concerns at all, they can ring me or email me. They can contact me and say, Jules, we need your help. And I'm more than happy to help them. So I have a special service to do that, and that's called the Baby Care Support Service. And what they can do is just contact me. I can pop over to their home just for 1 hour and answer all of their questions, help them out with everything. And it's usually sleep, settling, calming the baby, dealing with the cry, millions of things. And so the mothers just love it. They feel so supported in their own home. They don't have to pack up a million things and go somewhere and get dressed and stress over it and find a parking spot. So I'll come to them, and we already know each other, which is awesome. And they know that it's going to be really positive and a very kind, gentle baby care support service that they'll get from me. Do you know, I've actually had couples stay in contact with me for 30 years. Isn't that amazing? Yeah. So I've had couples that came through back in the late 80s, and we're still friends on Facebook, and we're still, well, Facebook hadn't been invented yet, but we stay in touch. Isn't that amazing? And all those babies have grown up, you know, gone to uni, they're working. And actually, I've actually had somebody come back, or a couple of them this year, where their mum came through the classes, and now the daughter is pregnant and the daughter's come to class. Isn't that amazing? Yeah, I'm teaching the next generation.
That's gold.
Isn't that lovely? Yeah. So what advice would I give to a pregnant couple? I'd say dream about how wonderful this experience is going to be. Deflect any of the negative stories, or if you find that you can't, if you find that you're getting negative stories, stop and think, what is it that those people needed to know that they didn't know? And how can I prevent that situation, that negative situation, from happening to me or us or our family? So look at it with solution-based thinking and try to be proactive. And rather than go, oh, okay, so birth must be terrible and having a baby must be awful. And people get told things like, sleep now because you're never going to sleep again. And there's all sorts of silly nonsense like that. And it's unfortunate that they are negative and that they can be a little bit ignorant. So they haven't had the information and they're not able to pass the information on to pregnant couples. So I think having that awareness that when they hear negative stories, it's usually that those people just haven't figured out the answers yet. And this is where they get all the answers. This is where they get all that really positive support. And also where to get more answers, where to get more help. Yeah. So if a woman has just had a baby, I say slow down, minimise visitors, minimise distraction, minimise any disturbance. Focus on your baby, fall in love with your baby. Give yourself the chance to fall in love with your baby. Give the baby unlimited access to the breast to give the baby the best chance of learning to breastfeed. And during that first week, babies are usually very sleepy. And most parents say, we're so lucky, we've got a good one. Our baby just feeds and sleeps. But that's normal with babies in the first week. And so in that first week, take advantage of that and rest. Rest as much as you can and learn to feed and sleep at the same time, breastfeed and sleep at the same time, and learn to eat and breastfeed at the same time. Yeah, you probably can't get that done in the first week, but aim towards that or understand that that's going to help minimise stress too. So the best way to access my services is to hit the website, julieclarke, with an e on the end.com.au, and then have a look at everything that's available, the dates, the details, maybe take some screenshots and mark it for yourself so that you can keep going back to it. I think most people hit the website about 3 or 4 times before they actually make a decision and book in. And you can understand that because they've got to tally up with their partner, 2 lots of calendars and find the right dates. So around about 25 weeks of pregnancy is the best time to come along. A lot of people do leave it really late, and I just accept anybody at any stage of pregnancy, even if they're 40 weeks pregnant, which is like the last week of pregnancy. And so if they're around 25 to 30 weeks, they're not too big and they're not uncomfortable. If they're 40 weeks, they might be very uncomfortable and very tired, and it's hard to concentrate and learn fresh new stuff at that late stage. But that doesn't matter. Yeah. Lots of friendships are made here. So quite a few people will match up with people and they'll swap phone numbers, and they're having babies around the same time, so that's really lovely. And I think one of the other things that marks a big point of difference with these classes is that I teach the active birth. So instead of laying down, like in Hollywood movies, what do they call it? The stranded beetle position, which sounds terrible, doesn't it? And women are on their backs. It's actually 1,000 times more painful for a woman to be on her back. And then when she finally gets to the pushing bit, the angle of the vagina is uphill. So she's got to push the baby out uphill, which is a hell of a stress and a struggle. And so if she pushes all that to one side, gets off the bed, she's active, upright, moving around, gravity helps her. And it's a quicker birth. It's a more comfortable birth. It's an easier birth. And so I teach all those really clever strategies for hurrying things up and making it 1,000 times more comfortable.